Hello, everyone. Herschel here with another negotiations update. We were supposed to negotiate with the district on May 1st. Instead, we met with the district on Tuesday, April 28th. I am very happy to announce, which I say a little sarcastically, we are just signed our second TA. That's right. Since January until now, we are on TA number 2. We signed the TA for Article 10I Flex Days. If you remember, we had gone back and forth with the district regarding the language on the penalty for the floating flex day. Essentially, we finally agree that the district would add language to clarify that if there are extenuating circumstances that need to be applied to the deadline, that it would be handled on a case-by-case basis. In some ways, this codifies what is happening in practice now. And that is going to be TA number 2, Article 10A Flex Days. Next, the FA offered a brand new proposal on Article 8G, Health and Welfare for Adjunct Professors. So last year, the district used a new set of dollar amounts to allow adjunct who join the single party plan to have free healthcare. However, they put a limit on the adjunct pool dollar amount to $1.4 million. Now, in the fall of 2025, their dollar amount was, I think, based on the number of people who joined, was about $1.4 million. We knew that that was going to happen. In the spring of 2026, as more adjunct knew about this and saw the benefit of joining a free healthcare option, joined the healthcare pool, and it exceeded the dollar amount. There is a TA from last year, let's see, a TA number 4 from 24-25. Should the amount of the total contributions for the year exceed the maximum annual pool, the district and the faculty association shall meet to discuss next steps. And those next steps have already started. And one way we are very proactive in those next steps is to write a proposal for the adjunct pool to be completely removed. Rather than a dollar amount capping the limit on the number of adjunct who can join, the FA proposed removing the dollar amount. So essentially, what the board stated, which is they think that adjuncts should have access to free healthcare, is actually possible for all the adjunct who qualify and want that option. Finally, we also returned a response to Article 10.0, temporary reassigned time for exceptional levels of service to the college. There are multiple parts of that article that we responded to. For example, we are asking to increase the allocated dollar amount for the projects from $5,000 to $10,000. We also specifically referenced language in Article 10 that defines an LHE. And we also discussed this idea of what happens to the report at the end of the temporary reassigned time for exceptional levels of service to the college. The district wanted to publish the report. The FA argued that there may be sensitive information, including copyrighted material, that could put the author and the district at risk, and that there is no necessarily benefit to having a report published on a district server. When, in general, when people complete their exceptional levels of service to the college, the report goes to the people that need to read it and not necessarily published for everybody to view, including those outside the college. All right, thank you very much. The next negotiations meeting is going to be on May 15th. All right, thank you.